Hypoglycemia. Hypoglycemia is essentially low blood glucose. Or to put it a different way, it's when blood sugar decreases to below normal levels. This lack of sugar in the blood may result in a variety of symptoms, including clumsiness, trouble talking, confusion, loss of consciousness, seizure, or even death. If a patient is showing one of these signs or appears altered in any way, check that blood sugar. The device used to check someone's blood sugar is the glucometer, and depending on what source you're mining from, this number can vary, but essentially, documented hypoglycemia is represented as a number of less than 60 milliliters per deciliter for children to adults, or less than 45 milliliters per deciliter for newborns and neonates. These numbers literally indicate the amount of glucose molecules in the bloodstream. Now, why is it so essential to intervene? As we talked about earlier, one of the main symptoms of hypoglycemia is an alteration in mental status. This is because the brain metabolism depends primarily on glucose for fuel in most circumstances. A limited amount of glucose can be derived from glycogen stored in astrocytes, but it is consumed within minutes. This is why the brain needs a steady, continual supply of glucose diffusing from the bloodstream. Therefore, if the blood glucose falls, the brain is one of the first organs affected. In most people, subtle reduction in mental efficiency can be observed in a blood sugar of less than 65. Impairment of action and judgment usually becomes obvious below 40, and if the blood sugar is below 10, the patient is in a coma. There are numerous ways to intervene and correct a patient in a hypoglycemic state. The end goal is to get the sugar back into the patient's bloodstream to ensure that the brain and the rest of the tissues of the body have an adequate supply of glucose. If the patient is awake and capable of safely swallowing, then oral glucose can be administered. However, if the patient is unable to swallow, then an IV line must be attempted so that dextrose can be delivered. But make sure the IV is properly established, because dextrose, a hypertonic solution, can rapidly dehydrate local tissues and cause necrosis. If an IV cannot be established, glucagon can be given via the IM route. Glucagon will stimulate the release of glycogen stores in the liver, and this will synthesize into glucose to raise the blood sugar. If, however, the glycogen stores are depleted, an IO site can be established for dextrose administration. So, what causes hypoglycemia? There are actually multiple factors that could cause a hypoglycemic state. The most common one is experienced by diabetes type 1 patients, generally due to too much insulin being administered into the bloodstream. In the diabetes type 1 patient, a balance must be struck between carbohydrate intake and insulin intake in order to bring the blood glucose into equilibrium. This balance of insulin and carbs can be shifted either due to the patient's equipment failing or simple human error. Hypoglycemia can also happen to people not diagnosed with diabetes type 1. It can be caused either by certain medications, such as quinine, causing kidney failure in children, for example. It can be caused by excessive alcohol consumption, depleting the glycogen stores of the liver. Critical illness of the liver or kidney, insulin overproduction due to, say, a tumor on the pancreas, or hormone deficiencies, such as an adrenal disorder. So, in conclusion, hypoglycemia should be suspected on a patient with an alteration to their mental status. A blood glucose reading should be performed and, depending on your local protocol, acted upon. If hypoglycemia is documented, introduce sugar to the patient via the appropriate route.